Hey guys, it's Dr. Daniel Sagai, board certified dermatologist. Thank you guys for subscribing to the channel. We have a very special series starting where I'm going to be reviewing different skincare routines from people of different skin tones, skin types, whether they're dry, oily, combination. We'll also break it up by age as well because teenagers, you guys don't need special serums. You don't need vitamin C. You don't need to be thinking about anti-aging practices besides wearing your sunscreen every day. So today, I have a very special guest. I have my head medical assistant, Leah. She's a pre-medical student, been working with me for the last 2 years. She's excellent. She's wonderful. She got into med school. Yeah! Okay, before we jump into Leah's routine, let's talk about your age, your skin type. What are your skin goals as someone your age too?
Yeah, so I'm in my mid-20s. I'm female, so that means I do experience hormonal acne. I live in Seattle now, so I don't have a ton of sun exposure, but I used to live in Los Angeles, so I got a bunch there.
Got it.
And I would say I have combo skin type where I get some dry, some oily, depends on the day.
Oily in the T-zone, dry in the cheeks.
Yeah.
Just like me. Got it. She's going to talk about her skincare routine and then also what she added that she sees hundreds of patients a week. She's going to get a feel of what didn't work, what works. We're excited to hear what she has to say about her new routine and I'll rate it. Let's review it today, okay? Let's jump into it.
All right, let's see it.
Okay.
So I started out with a simpler routine. It was based solely on acne. I did have some pretty strong cystic acne a few years ago, and so I was working with just topicals at the time, and the main one that I was using was Tratan. I know Dr. Sky talks about it a lot. He does mostly talk about it for anti-aging, but it is first and foremost an acne medication. So I've been using this since I was probably 14. I'm still going strong with it. I'm at the 0.05%, which is the middle strength, but it's what you recommend.
Correct.
0.1% doesn't do much.
Exactly. So you're on that before working with us.
Yes.
And
this is the before routine.
were you applying it to your entire face or were you spot treating it before?
I was applying it to my entire face,
Good.
but I was definitely not doing it every night.
Okay.
There were times where I was going about once a month, which could explain why I was having acne.
Even every other night to every night is a big difference than just doing it once a week or just once a month. And that was my critique towards that huge trend called skin cycling, which it doesn't make sense. When you look at the studies, you need to be on these prescription medications consistently. So I'm glad you brought that up. So now you're doing it more consistently.
Yes,
Perfect.
I try to do it every single night.
Great. And she mentioned nighttime because if she knows UV can make it not work as well. It's not very stable in UV light. So we like to apply this at bedtime. Perfect. Okay.
And then
What's
another
next?
thing that I was using before is this. It's another prescription. It's clindamycin. It's a spot treatment. It's antibacterial. It kind of stings when you put it on, but that's how you know it's working.
Correct. Yeah. So that's a good one. I do like to pair this with benzoyl peroxide because it helps prevent bacterial infection against that antibiotic solution. But right now we're in a rocky phase with benzoyl peroxide with that new study that came out. We've been talking about it with our patients. Right now, all we know is that if you blast benzoyl peroxide at really high temperatures, 120 to 155 degrees Fahrenheit for 18 days, which is not realistic, real life scenarios, the benzoyl peroxide product could break down the benzene, which is a group 1 carcinogen, which we don't want on our skin or inhaling. So right now we're gonna say keep it out of a sauna, out of a hot car, keep it in your bathroom and in a cool place, and you should be fine from what we know right now. We have to see if there's more studies or we can replicate those studies that Valley Shore did.
All right, and then the other prescription I did, I started this only when I was about 20, 21 or so. It's a sulfur cleanser. It's great. It has probably the biggest difference in my acne, especially it's really good for maskne, and we wear masks every day, and when I was 20 is kind of right around when COVID hit, so I was wearing a mask a bunch, and I totally noticed the kind of cheek distribution. So this has been great. Warning, it's sulfur-based, so it smells bad, but it goes away once you wash it off.
That's a really good product. This is a really solid routine, by the way. This is awesome if you have mild to moderate acne. It will address inflammatory and comedonal acne, meaning blackheads and whiteheads, really well. So this is a great start, Leah. Were you using any over-the-counter products with these?
I did have a Clinique salicylic acid spot treatment. It was a leave-on.
It was a leave-on.
And it was helpful, but not very much. I haven't used that in a few years.
And I like that you brought that up because people like to reach for the trending thing. Like Paula's Choice is a great brand, but that BHA, the salicylic acid leave-on, people see that and like, oh my goodness, this is gonna treat and cure my acne. But like you said, it could be out of the scope of what we're dealing with, and just going for something that's trending doesn't mean it's gonna be the right fit for you. And I feel like that's more of a supplemental thing to add on later after you have a good foundation, which this is a a great foundation given by your dermatologist, right?
Yeah.
These are prescription
All
medications.
three prescription.
Perfect. So what cleanser were you using besides the salicylic acid back then?
That's really bold. I didn't use any. I was bad at washing my face. I know.
Sad.
Yeah, so
Okay.
that's when the sulfur one helped, because if it was prescription, then I should actually use it, but otherwise there was not much happening.
I gotcha. Okay, got it. So you were just like kind of, when you were told to wash your face, that you're going to start using that cleanser. Perfect. Okay. Were you moisturizing with your tretinoin?
Yes, I've always had really dry skin and eczema, so I'm definitely big on the moisturizer. This is still the moisturizer I use on face and body multiple times a day. This is my baby. I love this thing. It's very affordable and it works really well. I cannot praise this more.
Perfect. So you like the ceramides, the hyaluronic acid, affordability, accessibility. You can run to Target, you can get on Amazon, and a little goes a long way. It lasts you a long time. Right?
Yeah, this will last me a few months, and it's less than $15. I just get it from Rite Aid. It's great.
Okay. If you had a cleanser in here, I would have given you a 9 out of 10. But I don't know. Maybe we'll have to give it like an 8 out of 10, I'd say. Maybe 7.5 because of the cleanser.
Just wait till you see the new routine. I've gotten better, I promise.
All right. Oh, wait, was there no sunscreen before too?
That's correct. And I lived in Los Angeles.
Oh, that's right.
Yeah.
But that's so common though amongst your age demographic. Do you feel that a lot of people weren't doing it on a regular basis?
Not at all. I would put on sunscreen if I knew I was going to be outside for an extended period of time.
Sure.
Never reapplied. Definitely burned. I was a lot tanner than I was now, which I know people think that's a beauty standard, but I know that means you're damaging your DNA, so we don't like the tan.
So her routine dropped quite a bit then. That rating went down to like a 6 then, huh? It's a 6 out of 10. I'm sorry.
That's even generous.
Oh,
I know
okay.
you love.
Okay, now we're going to talk about Leah's new routine, what she added in since working with us. So let's jump into that. I'm excited.
Yeah, so I just want to preface it with everything that I was doing before, I'm still doing, but I'm doing it correctly now and more frequently.
Perfect, because I think you had a good foundation, but no cleanser and no sunscreen.
Yeah.
So let's see. Okay.
Big one. So I'll start with the sunscreens just for you. I've got 3 that I brought with me.
3?
Yes.
Oh, good.
So the main one that I use on my face and then kind of wherever shows out of my scrubs is this Eucerin oil control. It's pretty new. I think it only came out within the last year or so.
You're right.
And it goes on super light. It's very sheer. I really enjoy it. It's also affordable. You can get it at Rite Aid, Walgreens, wherever. This is the only sunscreen that I found I've been able to wear all day at work and with a mask on that doesn't make me look super oily and sticky and uncomfortable by the end of the day.
Got it. Does it come on like a matte finish then, you'd say?
It goes on slightly shiny, but it dissolves and settles pretty quickly.
So it's absorbing some of that excess oil that we want to go after then.
It's called the oil control. Yes.
Perfect. So SPF 50.
Exactly.
Okay, good. We want to go for SPF 30 and above, so this is a big thumbs up for me. And even though it is a chemical-based sunscreen, you can see here, you know, Leah works in dermatology. We don't demonize chemical UV filters. She goes for whatever works well for her skin. People do talk really badly about chemical UV filters here in dermatology. We do whatever works for our skin. So boom.
I've always said to my friends when they ask for sunscreen recommendations, I just always say whatever works for you as long as it's SPF 30 and above. Because if it's something that we recommend and you hate it, you're not going to wear it. Right. So there's no point. So it has to be very personalized and tailored. Exactly. So now the other 2 sunscreens I brought were 2 La Roche-Posay sunscreens. I use these for my body. This one you can get here, but this one is only in Europe.
You're right.
When Dr. Sugai goes on all of his conferences, he brings me some back. Thank you.
You're welcome.
Yes,
yeah.
So this is a nice little size. So I actually keep this one in my car if I'm driving and I'm feeling that sun exposure on my arm. And then this is the one that I keep at home and I use on a more regular basis.
I love this one. This sunscreen is 5 fluid ounces. Goes on really well. This is chemical based, I believe. Really lightweight, right? I like this one a lot. Really good. This one, the UVMune 400, it goes after long UVA wavelengths. So it's covering a broad spectrum of UVA, UVB, but especially the wavelengths that we worry about causing worsening hyperpigmentation. This is a really nice one, and I wish the US would be able to expand their UV filters, but unfortunately we gotta go to Europe and grab these. So I'm glad you're liking these. And can you say it the French way, the brand name?
La Roche-Posay.
Oh, very good. La Roche-Posay. Very good.
Yes.
Very nice. Okay, so proud of you for wearing it. And this is every day, right?
Every day.
Even if you come in, you're saying, come into our clinic where there's barely any windows.
In the dead of Seattle winter.
Yes, and you're still wearing sunscreen.
Yep.
Man, that score is going up. Okay, all right.
I know you were next bothered by my lack of cleanser, so I brought you the one that I'm using. It's this CeraVe salicylic acid cleanser. I did used to use the benzoyl peroxide. I used Panoxyl, that brand, and to help with, as you're saying, the antibiotic resistant with the clindamycin.
Perfect.
But since all the studies have come out, I've stopped that one. Another benzoyl peroxide product that I used to use that I no longer do because of that study was the La Roche-Posay Effaclar Duo. And I found that it packed such a powerful punch that it really destroyed acne, but then left me with a kind of a red ring around. That sometimes was so bad that I'd have to use a topical corticosteroid to get it to go away. Which you're not really supposed to use on your face. Sorry.
She knows how to do it appropriately. Okay, got it. All right, so yes, I think this is a really good cleanser here. You have the 2% salicylic acid, and then you also have the vitamin D. It's just gentle, right? Not too drying. Works really well for combo skin all year round. So I like to use this cleanser for my face and my body, especially after working out, going for a run, going to the gym. Your clothes are all sticky. You want to get out of those wet clothes as soon as possible and wash your body with this to clean out your pores. Perfect.
Yes.
Nice.
On another note about that one, I do find that if I wash my legs with it before I shave, it really minimizes razor burn and ingrown hairs.
That's a really good tip there because we get that a lot. Ingrown hairs for people shaving, grooming. Guys, the razor burn here, we call it pseudofolliculitis barbae here. That's a really good tip to wash, cleanse before you shave. Perfect. All right, nice.
All right. And then the only kind of non-acne related, semi-beauty, aesthetic related.
For funsies.
Yeah, is this product. It's a L'Oreal caffeinated under eye serum. It helps out with the kind of underbags, the darkness there. I do apply it at night because I find that it can be a little sticky, so my makeup will stick to it. So I put it on at night and it kind of sucks things up before the next morning.
Right. So even if you are in your mid-20s, to me, you're so young. I was like, wow, why are you using these serums? But everyone deals with these under eye issues, whether it's puffiness, dark circles, it could be skin laxity, and some people want to work on some of the wrinkles that are starting to form there. So hyaluronic acid is a nice sugar that draws in water and helps plump up the skin. You also have caffeine to help tighten up the vessels that might be causing discoloration there, and also the swelling and puffiness you might get there. So nice. Have you ever put it in the fridge?
Oh, you've told me that. I just know if it's in the fridge, I'll forget that it's there.
So exactly, yeah. You want to be able to use your skincare. You know, I don't ever say you guys need skincare fridges, but if you did, buy your
this would go in.
Yeah, go in there, and then that cold wand. I don't know if you want to show them the wand, but the wand is this stainless steel
kind of like
beads,
this beaded.
and so you can keep it cold and then apply it. You can actually just gently go and kind of stroke it out laterally to help drain the lymphatics to the side here and help with the puffiness. That's a good serum, affordable. You can get that at Target, maybe Walmart, but definitely Amazon.
This is the second to last one. So this is the only prescription I've added since working here. It's called a Clea. It's triferritine. It's another retinoid, so it acts similar to tretinoin, but this one is a little bit lighter. It's more of a lotion than a cream, and I find that it goes on really well for chest and back if you ever get any body acne, or it can also help with anti-aging in that sense too.
I'm glad you talked about the texture there that sets it apart from tretinoin, which you always say that pea-sized amount to your entire face. This thin film on your body rubs in well. Great tip there.
And I definitely don't see it being as drying as the tretinoin at all. I still do put moisturizer over it, but I don't feel as though I need to.
Got it. And you'll use the CeraVe daily for this?
For everything.
Okay.
Yes,
so after tretinoin and after a Clea, perfect.
Use the CeraVe.
Great. Nice.
And then the last one is what I added most recently. It's super simple. It's spearmint tea. It tastes really good. I've heard it kind of tastes like you're drinking toothpaste, but I'm not mad about that. It's okay. I really like it. It's refreshing. You're supposed to do it twice a day, 2 cups. And I just get this at my local grocery store, super cheap and easy. And it is good for hormonal acne, which, as I was saying earlier, I'm a female in my 20s. So that puts me right at that demographic for jawline acne, which is the hormonal distribution.
Exactly. So they came out with some studies showing that spearmint tea, drinking 2 cups a day, can help with the androgens involved with that jawline acne, like Leah mentioned. Really can affect the chin. That jawline, we say the U-shaped distribution, is so stubborn in your mid-20s and on. We see in the 30s a lot, and females in their 30s. So this is a nice hack. You're going to teach your fellow med students about hormonal acne, the mechanism, and spearmint tea. Like, you're going to have so many skincare hacks to share. So very proud of Leah for adopting this. You know, we talk about this in clinic, but she's actually adopting it and doing it herself, and you're seeing results with it too.
Absolutely. I bring a cup of spearmint tea to work every day. There are ones on Amazon, but this specific brand I've just gotten at the physical grocery store.
Got it. Okay. Well, Leah, I have to say that this routine for someone in their mid-20s, combination skin is a huge winner. I think this is great. I gotta give it like a 10 out of 10, really, for like someone who is struggling with acne. So there are gonna be viewers out there who are your age demographic, your skin type, and you're out there giving a good example. Sunscreen every day, no matter what. You're in cloudy Seattle or you're in the summer somewhere in Hawaii, you're gonna be wearing sunscreen every day. If you have acne, we have solutions for your face, your body. You have the tretinoin for face that we say to use at bedtime. You have this newer synthetic retinoid for your body. And if you want some funsies, some goodies, you got a nice serum for on the eyes, but you're also getting some anti-aging from stuff like this. Tretinoin is one of the most well-studied products or ingredients out there that help with collagen production, keeping your pores clean and helping with hyperpigmentation. So this to me is like my foundation. I would say though, if you are a female and you are pregnant, you would have to hold off on any kind of retinoid, whether it's tretinoin, retinol, or a Clea, okay? So that's just a little thing to note. So very good.
Yeah,
all right,
so
Leo.
I know I got a 10 out of 10, but do you have any recommendations for me, Dr. Scott?
That's a good one. You don't deal with hyperpigmentation, but if you ever wanted to brighten the skin, you could always do a vitamin C serum in the morning. If you're feeling dry in the morning, which I do, you don't have to cleanse. You can go ahead and apply your vitamin C serum right onto your skin, and then you can put your moisturizer and then your sunscreen after it. A lot of sunscreens are coming out now that are very moisturizing as well, and you may not even need a moisturizer and then a sunscreen. You can get a moisturizing sunscreen as well, like Roche Posay makes a Tolerian Double Repair UV. You have Neutrogena's Hydro Boost Moisturizer SPF 50. And then, of course, CeraVe has an AM, which is, I think is a little thick. Our patients might say...
I've used it before. It's a little sticky, yeah.
Yeah, and then they made an ultralight lotion, which is really nice, the SPF 30. So you might replace your AM with that. The niacinamide in the AM, CeraVe, is nice for those who are acne prone. So you could do something like that. What kind of finish? Matte or more glassy skin? What finish do you like with?
Kind of in the middle. I think people can go too far with the dewy and look sweaty.
Mm-hmm.
But if you look totally matte, then you kind of get washed out. So that's what I do like about this one, is it kind of puts me at that in-between level.
Have you ever slugged before?
No, I'm afraid it'll worsen my acne.
That's good that you brought that up. Traditionally, Vaseline or CeraVe healing ointment, they're not comedogenic, but yeah, putting gobs on, you will clog up your pores and get into trouble with whiteheads, milia, we see a lot in clinic. Mm-hmm. Just a small pea-sized amount. If you're going out and you want a little shine there to accentuate, have a little of that glassy look, you could totally put a little bit of Aquaphor there. You can put it on your lips as well. Another thing is hyaluronic acid you could throw in if you're feeling like you want a little bit of that extra glow before going out. You can cleanse, and while your skin's damp, apply hyaluronic acid and then apply your moisturizer over it to seal all in that hydration, and boom, glassy
Perfect.
Skin. So yeah, I mean, just little things to fine tune it, but I think overall this is the foundation of what I would recommend for someone in your age demographic. So I'm so proud. I taught you well, huh? Everything
Yes.
she knows I taught her.
Yes.
All right, well, thank you, Leah, for being on the channel. I'm so proud of you. Good luck with everything. I think like our patients have a little fan club for over Leah and her other MA, but you can see that she's very genuine, very easygoing, but it's good to have different dimensions so you can give a little sass in the videos. The master of lip syncing. So we're very proud of you, Leah. Good luck with everything, and thanks for being on the channel.
Thank you, yeah.
Boom. Thanks for watching, guys. Please hit the subscribe button. Please hit the bell notification every Saturday morning. We're having a new video, so share with your friends who are into skincare, especially if they're in their mid-20s and with combination skin. See you guys next time. Peace.